Well, this morning on the show, we're going to talk about fatty liver. What is fatty liver disease?
Well, it's the fastest growing chronic condition that we have today.
Really?
Yeah, it really is. It is, you know, if you go back to like 2000, which is 24 years ago, very little was in the public about it. I mean, very little, just wasn't talked much about, even in medicine. Now, 24 years later, and that doesn't sound like too far back, 2000, I mean, it's just yesterday.
Yeah, it seems like it.
Seems like it, anyhow. Now, all of a sudden, you know, we've got something like, they estimate something like 60 million people in America have fatty liver disease. That was as of 2014, I think. It's the last statistic I saw on it. Since then, it's growing rapidly. I mean, it just keeps doubling, you know, every time they do statistics. And the bad thing about fatty liver disease is it turns into something that can be very bad. It can turn into cirrhosis of the liver.
Yeah.
You know, and we call it.
It takes a while to do that.
It does. It does.
And some people's do and some people's don't. But everybody has heard of cirrhosis and knows that when it does turn into that, that's not good.
No.
Because that's what we're going to talk about today. You know, what is it, how you know you have it, and all that good stuff, but also what to do to reverse it, because you can change it if it's early.
Yes.
You know, there is a point of no return, and so there is a point at which you can't reverse it. So you definitely want to do it early. Yep.
So what are some of the symptoms?
You know, a lot of times there are none. That's
Really?
that's the bad part. In other words, typically speaking, is how you feel. Now, maybe occasionally they'll have a little pain in their right side, upper right quadrant there. And they'll say, well, you know, something's thinking that most of them will complain, I've had indigestion. Okay, it's doubtful. But anyhow, that's kind of one of the few things about it. Typically, it's picked up on, you know, if they do imaging, like for instance, if you had an x-ray or something, they'll pick it up and say, whoa, you know, we've got a problem here.
Not necessarily an x-ray, but more of an ultrasound and CT.
CT, it's an incidental finding on CTs, things like that.
And the MRIs.
Yeah, but even an ultrasound, I mean, even a plain x-ray will show definitely what we call a more hypoechetic liver. And so we know, okay, there's a problem there. And a lot of times, or maybe your liver enzymes are elevated. You go to your doc for your yearly checkup, and your ALT's pretty high, and they say, something's going on with your liver here. And the bad thing about it is over the years, we've seen them raise that number. You know, used to 30 was kind of a top end for an ALT, which is an alanine transaminase, which is part of the liver enzymes. And now they're up to like 40 something. They just keep raising them up because the average person
has a problem.
Probably got a problem.
A lot of people don't realize that the normals on lab work is a sample of the population.
Right.
So as the population gets sick, the range gets wider on all of your lab work. So we always look at optimal ranges for that reason, because you do have different ranges the more people that get sick, and you know, who wants to be okay just because everybody else, or sick because everybody else is. So you don't want that. Right. And with the liver, you don't even have to have elevated liver enzymes to actually have fatty liver. True. You don't know how many people come in to us and tell us that they've been told they had fatty liver. Like I said, most of the time it was an incidental finding. They didn't go in complaining of anything. They were just told by some sort of scan they did on something else that that's what it was. So one thing that we do see, though, the people that come in that have high triglycerides and pre-diabetic or diabetic, almost all have fatty liver. If you went and did an ultrasound or a CT of their liver, almost everyone would show having a fatty liver. And a lot of times people don't, like I said, don't have symptoms until it's really advanced. And like I said earlier, you want to do something about it before it's advanced. So it makes a big deal when you find out you have it. Now, another thing is if you are overweight. I mean, if you were overweight and you gain all your weight in the middle, again, you probably have fatty liver.
Most likely. Yeah, he's looking.
He's looking at himself.
Well, man, that's kind of what we have to look at, you know. And you know, there's what's bad about it is you tell people this, and you can kind of get that deer in the headlight look, you know. And you say, well, you have a fatty liver, and they're like, okay, they don't know what to think, or and now it's becoming more prominent now, and people are talking about it a little bit more. And there's a test that we've had to do in the past. It's called a FibroSure, I believe it is. And what it'll do is it'll tell you how much damage is going on, how much fibrosis. And fibrosis is the step before cirrhosis, okay? So just think about that. And sometimes we have to do that FibroSure test to kind of get somebody's attention.
Yeah, because we've had people over the years that you'll tell them they have fatty liver and don't mean anything. And then they may do a test like that shows how much fibrosis they have, and it freaks them out completely. And it's like, well, we've already told you what to do for it and how you can get rid of it. And people don't think it's a problem until it gets really advanced. And so you want to pay attention.
Is there a point that it can get to where you can't reverse it?
Yes.
And once it gets to that cirrhosis,
it's hard to reverse.
Cirrhosis is basically scar tissue. So once that liver gets enough damage, and it's all caused from the inflammation and so on that's going on, once it gets to that point where you have that fibrosis, you have scar tissue. And that scar tissue, you're not going to turn that around.
Well, usually when somebody talks about having cirrhosis of the liver, you think about, well, it's too much alcohol.
Well, when I've been doing this for about 43 or 44 years. Back then, when I first got out of school and was in school, even, you look at patients, and you rarely saw a problem. You really did. I mean, it was rare. And if you did, bingo, it was real simple. It was probably alcoholic and alcohol induced, let's put it that way. And nowadays, it's not so. I mean, I got the 85-year-old little church lady that's never had a drop in her life comes in and she's been told she had a fatty liver, and it's freaking her out. And I'm thinking, well, yeah, okay, I understand, but you're overweight. You've got really high triglycerides, you're pre-diabetic, you're not quite diabetic yet, but you're working on it. So keep going and you'll get there, and that's kind of what we see. I mean, literally that's what we see every day. And it's getting worse and it's getting more and more because, here's the problem. The lady, not too long ago, I told her, I've been telling her she had fatty liver, finally did that FibroSure test, said, yep, okay, you got fatty liver. So she takes it to her primary care doctor, and her primary care says, "Oh, you've got, you've got really bad fatty liver." And I said, "Okay, what medication did she put you on?" "Well, none." I said, "Really? You know why they didn't put you on a medication?" She said, "No." I said, "They don't have one. There's no medication for this. This is not something I can give you a pill for." "Oh, what have I got to do?" "Lose weight." Oh my God, how am I going to do that?
And change the diet, and we'll talk about that when we come back.
Yeah.
All right, talking about fatty liver disease this morning. We're going to take a break and we'll be right back. And welcome back to this week's edition of the Doctor's Nutrition Show. We're talking about fatty liver disease. What kind of impact does your diet have on that?
Huge.
That's what causes it.
Right. That's what really causes.
Let me guess. Our old friend sugar.
Well, it's one of the causes. They have actually had medications they're finding out is also a factor in fatty liver.
Really?
Mm-hmm. Yes. And so always look, if you have fatty liver, you need to check and make sure you're not on a medication that actually makes it worse. Mm-hmm. And also, I mean, they know diabetes makes it worse, but what causes diabetes? Your diet. So again, now steroids, they know steroids is one of the drugs that actually can increase it, but steroids makes diabetes, diabetes makes fatty liver, so it's like a never-ending cycle. And so there's a lot of things that go into it, but diet is number one, and it's sugar and carbohydrates that do it, not fat. And everybody thinks it's because it's fatty liver that, oh my gosh, it means that fat is what's causing it. It's not.
Yeah, the lady I was told about in the last segment where we did the test and finally proved it to her, took it to her primary care. Her primary care said, "Well, you got to lose weight." And I said, "Okay, so what did she tell you to do?" She told me to go on a low-fat diet. I said, "That's what got you in trouble to begin with, was a low-fat diet, because low-fat equals high sugar and high carbohydrate. Because you're going to eat something, okay? And if it tastes like garbage, and most low-fat stuff really does, so if you do that, you're going to eat more carbohydrates. And if you try to keep the fats to nothing, and we got to have fats, that's a whole different show.
Right.
But that in itself is one of the leading causes, and you can go back to 1974 for that one. So
I graduated high school.
Yeah, yeah.
Can liver detox help aid with liver problems?
All right.
Yeah, we need to talk about different.
Well, here's one of the problems about liver detox. People say, "Well, I need to detox my liver." Folks, your liver is your major detox organ, okay? Yep. It's working 24/7, whether you know it or not. It's trying. every minute, a liter and a half of blood goes through that average adult liver. It's trying to be processed, filtering, getting rid of, detoxing, getting rid of stuff that shouldn't be there, and so on. So that's the key. So the big thing you want to do is quit putting toxins in, and then from there.
Right. Then you can, if you keep toxifying, there's no way of detoxifying.
No.
And we even have a really good liver product for detoxifying. It's called Liver Support and Detox. Although if somebody has fatty liver and the first thing we do is put them on Liver Support and Detox, it doesn't make it better. The problem is when you've got all this fat in the liver, it can't detoxify properly. It can't just detoxify and be back to normal. You have to change what's going through it. And what the blood that it filters, you have to change what's in that blood. And that's one of the big things. So there's a few steps that actually you can take if you have fatty liver, which many, many people do. And I mean, especially where we live in South Mississippi, we see a lot of it. That's one reason we decided to do this show, because we see so much of it. Is you got to do a few things. One, intermittent fasting. So the more food you eat, the more you process things, and it's just not great for that liver. And you want to go to intermittent fasting, and we've had shows on intermittent fasting. And so you can even go back on YouTube and probably find our show on intermittent fasting. But the intermittent fasting definitely does something called autophagy. So it actually helps the body get rid of some of the bad cells that cause problems. So that's just to put it simple. So intermittent fasting is good. Got to go on a lower glycemic diet. And so
y'all have a great low glycemic diet at the store.
So and you have to lose weight and you have to control your blood sugar. If you are pre-diabetic or diabetic, that sugar has to come down. And so you do have to do those steps. There's also a lot of things natural that can help. But again, we always tell people you can't just take a pill and fix this without changing your diet. So the diet is number one. So you have to change the diet. And some people don't like that idea, but you got to do it.
You know, it's a fact of life as to how the liver functions and what it does, and because a lot of those carbohydrates and stuff that you eat that we can't use in the form that it's in when we eat it. For instance, if you eat a potato, pretty much most of that's glucose. Well, your body can use that. But other stuff, body looks at it and says, gee, I mean, yeah, it's cool stuff, but I can't use it. So the liver takes it and says, oh, don't worry about it. I'll make a triglyceride out of it. So that's where your triglycerides are made, is in that liver, okay? First thing the liver does, it says, okay, I got this triglyceride, well, I'll just kind of hold on to it here. When you need it, let me know. Well, the body's got tons of this stuff floating around in the bloodstream, so it don't need it. So what happens? It stays stuffed right there in the liver. So there's where the problem starts, and that's how it accumulates. Your liver's doing its job. It's making these triglycerides, and it just kind of stores them until you need them. The problem is you eat too much and you don't need them anymore.
Right.
So.
And then you start damaging the liver because of how much is in there.
Right.
And I always say it's kind of simple, but the liver is a filter. And it's kind of like, you know, when you have high triglycerides, it is fat in the blood. It does not come from fat, but that's what a triglyceride is one of the free fatty acids. So if you actually, what if you took a coffee filter and you poured bacon grease through it? It would kind of clog up. Well, it's exactly what happens to your liver. But what's making those triglycerides is sugar and carbohydrates. And not all carbohydrates. You want the high glycemic carbohydrates, I should say.
Well, the various forms of sugar, and there's there's tons of them. So that's really the thing, and especially the folks that are doing the high fructose corn syrup. I mean, I don't care.
That's horrible.
Yeah.
The introduction of high fructose corn syrup has really increased fatty liver.
Yeah.
The no-fat diet that everybody wanted to go on in the 70s and 80s has really increased diabetes and fatty liver. So when you start looking, that's what caused it, is the change of the diet in the 70s and 80s. And
well, there are good fats out there. Good fats. I mean, avocados have good fats in them.
One of the things they've shown to help fatty liver a lot of times is fats. One of your biggest is tocotrienols. Tocotrienols is in the vitamin E family. And tocotrienols is great for helping fatty liver. That's probably the number one thing we use. It's a product called Natto E300. It's a real high dose tocotrienol. We also have tocotrienols in our E-Plex. So we do that. There's, like I said, TUDCA. There's actually an herbal that has definitely been shown to help fatty liver as well. So we use different things for fatty liver, not the liver detox at first. Now after you start getting better and you start changing other things, then we can detoxify the liver toward the, after you've changed things first.
All right. We're going to take our final break, and we'll come back in just a moment talking about fatty liver this morning. And welcome back to our final segment this morning. We're talking about fatty liver. Are there any other supplements that can help with fatty liver?
Yeah, you sure are. And one of the biggies, and believe it or not, it's fat, is omega-3 fats. We've talked about that a bazillion times, and they are good because they're anti-inflammatory, and they help tremendously in that respect, because most of what the problem caused by the fatty liver is inflammation and what the damage that can be caused from inflammation. So that's probably one of the biggies. She mentioned
we already mentioned tocotrienols is a big
Right.
one. We mentioned TUTCA. There's also milk thistle. Now milk thistle is not just to where it will get rid of it, it really supports the liver.
Protects what's left.
It protects, exactly. So very protective when you do milk thistle. Like I said, there's another thing called choline. A choline deficiency can actually be one of the causes of a fatty liver. So it's one of the things that you want to make sure you get enough of. Now, what's so funny is what foods have choline? All the stuff they tell you to stop eating when they reduce fat in your diet, which is egg yolks, beef, chicken. Now, cruciferous vegetables also have it, but it's funny because it's mostly your higher fatty foods have choline, and choline is really good for fatty liver. Now, we use something called phosphatidylcholine, which is actually it's a type of a choline. And we also have CDP choline, which is usually for brain function and memory and things like that, but it also increases choline in the body, which can also help with fatty liver. So our, CDP choline is good. So there's a lot of things you can do. Like I said, diet's number one. Can't say that enough. You gotta change your diet, gotta lose weight. And even if you don't think you're overweight, you gotta lose weight. Because even on him, in his 40s, he had fatty liver. And that was way before a lot of people had it. That was 30 years ago because he had the high triglycerides. He had the underlying genetic issues.
I had the astronomical triglycerides.
And at the time, he's 6 feet tall, and he weighed about 165, 170, which most people would say is not overweight. But every bit that he gained was in the middle. So now he's 135, 138 pounds, depending on the day. And everybody's like, oh my God, he's so thin. I'm like, if he wasn't thin, he probably wouldn't be here. Because he has that bad of a metabolic problem, and it is genetics, but the way you combat it is to lose weight, even if you think you're not overweight.
We had a classic example. We have a patient that they travel a lot, and they wind up in like Denver, I believe it is. And if you look at the gentleman, he's always nice and trim. His doctor in Denver told him, you need to lose about 10 pounds. And he was, what? He was like, what? He said, you need to lose about 10 pounds. And he was like shocked that need to lose 10 pounds. I said, well, you get most anybody, most, now not all, but if I lose 10 pounds, there's going to be trouble.
Yeah.
But,
you don't need to lose 10 pounds,
but most people,
I need to lose 20.
Right. Most people could lose 10 pounds, and they, whatever, really amazing. They always come back and tell us if they lose 10 pounds, I feel so much better.
Oh, yeah.
Wonderful. Okay, cool. Let's keep it up. And that's one of the biggest problems we've got in health today is people being overweight and the various consequences that come from it.
And if you start losing weight and you have all the people around you keep telling you you're losing too much, in most cases, don't listen to them.
Oh, in most cases.
I have more patients that when they do what we tell them and they start listening, they start losing weight. And everybody around them is like, oh my God, you're losing too much weight. And they're still overweight. I have people all the time that freak out and like, oh, I'm losing weight. And I'm like, yeah, you changed your diet. If you change your diet, weight loss, sudden weight loss is bad if you've done nothing different.
Right.
If you are doing something different and taking sugar out of the diet is absolutely one of the things that's going to make you lose weight. If you're doing something, that is not a problem. So, but I hear that every day. Oh, so-and-so told me I needed to stop losing weight. And I'm like, no, you want to be healthy? Your lab work's looking better. And it's going to keep looking better as long as you keep the weight down. So we see a huge difference in lab work on people that change their diet. Huge difference.
Yeah,
is.
it goes back to, you know, we talked about the carbohydrates and the insulin. Insulin resistance, of course, we've talked about that, you know, ad infinitum on the show. But insulin resistance is kind of the starting point of this thing, because that starts an inflammatory process, you know, by itself. And so, and the reason we do have too much insulin or have the insulin resistance is too many carbohydrates. And, you know, that's, you know, there's just some really, you know, big details about the carbohydrate thing. And, you know, that's where if you look at most food that most people eat, you know, go through a day in the life of, I do this all the time with patients. I say, you know, write down everything you had, breakfast, lunch, dinner for a couple of minutes, or for a couple of days or so. And they'll take a couple of days, write all this stuff down, come in, and the majority of it, probably 90% sometimes, is carbohydrates.
Right.
They don't think it is.
Yeah.
You know, oh, well, I eat beans, because beans have protein. Beans have this much protein, that much carbohydrate. Okay, so that's the problem with it. I mean, yeah, they've got some benefits, but at the same time, they got a load of carbohydrates in it.
Yeah, really.
That's one of the problems. I'm Dr. Fox, and I want to thank you for watching this YouTube video. Be sure and hit that subscribe button, hit that little bell so you'll be notified on any upcoming videos that we have coming up. And thank you again for watching our YouTube videos.